Hi everyone. Today in this video we are going to discuss another drug, Bisoprolol. What is this drug Bisoprolol? The suffix olol indicates that this drug is a beta blocker. But we have so many types of beta blockers. Few of the drugs are selective and many of the drugs are non-selective beta blockers. Among these, Bisoprolol is one of the cardio-selective beta blocker. So this drug is selectively blocking the beta-1 receptors expressed on the cardiac system. Thereby it reduces both rate as well as force of contraction of the heart. And from the name of this drug we can identify structural information. So here the suffix olol indicates it's a beta blocker. And the infix isopro indicates that this drug is having isopropyl chain. So bisoprolol is having the two isopropyl groups. One of the isopropyl is attached to the amine and another isopropyl is attached to the oxygen on the two terminals of the structure. And since this drug is a beta-1 blocker, this drug is used in the treatment of hypertension. Either it can be used alone or it can be combined with few of the diuretics such as hydrochlorothiazide. So today in this video we are going to see how this drug acts, what are the important precautions, side effects, dosage, all these things we will discuss in this video. First of all, what is the chemical nature of this drug? So this is the structure of bisoprolol. Just like other beta blockers, this drug is also an aryl oxypropanolamine. So here we can observe the propanol structure. Let us give the numbering 1, 2, 3. So simply it is propane 2-ol derivative. And at the first position is the amine group which is attached with isopropyl chain. So this isopropyl group can be written as propane 2-ol which is attached to the first position of propanol. So we can write this as 1-propane 2-ol amino. Then at the third position it is having this ring. So this is nothing but the phenoxy. So we can write this as 3-phenoxy. And this phenoxy group is attached to methyl group at the fourth position, so 4-methyl, which is further attached to the ethoxy chain. So ethoxy, and finally to this ethoxy at the second position again another isopropyl oxy group is present. Now this can be written as 2-propane 2-ol oxy. That is the complete name of bisoprolol. You can easily observe bisoprolol is having the two isopropyl groups on both of the terminals. Now let us see how this drug acts. Bisoprolol is one of the cardio-selective blockers, so it is blocking the beta-1 receptors expressed on cardiac system so that it can reduce the rate of contraction as well as force of contraction. This results in the decrease in the cardiac output. So bisoprolol can reduce the blood pressure by reducing the cardiac output. And this drug can also block the renal system such that the renin release is somewhat inhibited, which reduce the activation of renin-angiotensin system. And finally, this drug can also act centrally to reduce the release of catecholamines. So central sympathetic discharge is somewhat inhibited by bisoprolol. But its main action is on the heart where it is going to reduce cardiac activation, thereby it reduce the force of contraction. So within the heart, beta-1 receptors are expressed which are G protein coupled receptors coupled with alpha beta gamma subunits. When the norepinephrine is released, it can act on the beta-1 receptors which activates the adenylyl cyclase system. This adenylyl cyclase can convert the ATP into one of the secondary messenger cyclic AMP. This cyclic AMP can stimulate the protein kinase A, which are the phosphorylating enzymes responsible for control of many of ion channels. So they can increase the intracellular calcium levels, which is responsible for contraction of cardiac muscle. So within the heart, actin-myosin filaments require the calcium. Now the calcium can bind to calcium binding site so that it can remove the block of troponin, resulting in the sliding of actin and myosin to produce contraction of cardiac muscle. Now bisoprolol is a cardio-selective blocker. It can selectively block the beta-1 receptors so that it can inhibit the activity of beta-1 receptors, thereby it can inhibit the contraction of cardiac muscle. In this way, bisoprolol can reduce the cardiac stimulation, thereby cardiac contraction. What are the precautions? Just we have seen that bisoprolol is selectively acting on the cardiac system and it blocks the beta-1 receptors. So this drug is somewhat selective towards the beta-1 receptors. And at low dose, it is not showing any significant activity on beta-2 receptors. But at the high dose of this drug, it can show some activity on beta-2 receptors. So at high dose, bisoprolol can block these beta-2 receptors which are expressed on many of the organs. So this drug at high dose, it can affect the function of liver, lungs, and even thyroid glands. So by blocking beta-2 receptors at these organs, bisoprolol can produce some hypoglycemia which may result in tachycardia, and it can produce bronchospasm which is more significant in asthmatic patients. So even it is somewhat selective, but still care should be taken in the patients with any respiratory disorders or patients with uncontrolled diabetes. Similarly, this drug on sudden withdrawal, it can increase the action of catecholamines on the heart so that it can increase the risk of angina and myocardial infarction, and even it can increase the ventricular arrhythmias. So the dose of the drug should not be stopped suddenly. It should be tapered slowly in order to avoid withdrawal effects on the heart. Similarly, this drug can affect arteries and it can produce some arterial insufficiency so that the blood flow is going to be reduced. That's why in the patients with any peripheral vascular disease, this bisoprolol should be carefully given. Similarly, bisoprolol can reduce the cardiac output in the patients. So in the patients with congestive heart failure, this bisoprolol should be given carefully as it reduces the force of contraction, thereby further reduce the cardiac output. What are the side effects? Bisoprolol mainly produces bradycardia as it reduces the rate of contraction, and it can produce few of the central side effects such as headache, dizziness and fatigue, asthenia, lack of energy, and few of the respiratory side effects such as sinusitis, pharyngitis can be produced by this drug, and it can also produce diarrhea, bronchospasm, insomnia, lack of sleep can be observed. Finally, it can produce some peripheral edema within the patients. How it is given? This drug is available as tablets at different strengths such as 5 mg and 10 mg. The initial dose of the drug for the treatment of hypertension is started at 5 mg because at the low dose, few of the side effects such as bronchospasm and hypoglycemia can be minimized. In few of the patients, the dose can be further reduced to 2.5 mg, particularly in the asthmatic patients with any risk of bronchospasm. This bisoprolol should be used at very low dose. In other patients, the dose is started at 5 mg and it can also be increased up to 10 mg, and further it can be increased up to 20 mg based on the efficacy of the treatment. But at the high dose, it can produce non-selectivity towards the beta receptors, resulting in few of the side effects such as bronchospasm, hypoglycemia. So at high dose, this drug should be carefully used. So that's about this drug, bisoprolol, which is a bi-isopropyl derivative, and it is a cardio-selective beta blocker acting on beta-1 receptors. This drug can be used either alone or in combination with diuretics for the management of hypertension. As this drug reduces cardiac output, it should be given carefully in the patients with congestive heart failure. This drug should not be withdrawn suddenly, and the dose of the drug should be tapered slowly in order to reduce withdrawal effects on cardiac system. In our next video, we will come with another interesting drug. So that's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.